Hey, we're talking about shockwave therapy today. Shockwave therapy has been out for years. We in medicine have known about it, but specifically in the wellness section, it's good for men and women. And so we're going to talk about shockwave. But before we talk about shockwave, specifically for men, we're going to explain what is happening during an erection.
Yeah. And thank you for that, Jennifer, because I really need to let our audience know that we will use the specific word for the male anatomy. This is called the penis. And we are not going to be hush hush about this. This is a very important part of anatomy, and it is should be able to be openly talked about. Penis is not a bad word. Okay, so how does an erection happen? During an erection, the corpus cavernosum fills the vessels that are there filled with blood, specifically blood vessels. They fill with blood, the erection starts to happen. So this is a very simple breakdown of how an erection actually happens. And why we would want to introduce shockwave therapy is because as we age, or as males age, they can actually experience a little blockage in those smaller vessels that are feeding all that tissue with blood, which blood carries oxygen, very important. So if the blood is not flowing, the erection isn't happening. That's the pretty much the 2 + 2 = 4 there. So Jennifer, can you tell us a little bit more about shockwave therapy and why that would be important?
So with shockwave therapy, going back to you're talking about the vessels, what shockwave therapy is, it's like the rotor-rooter for your heart. And so during that type of procedure, the shockwave is actually helping to break up some calcifications that may be in those smaller vessels, and so that the blood flow can have that better deposit into the skin tissues, or the oxygen, so for tissue vitality, because the shockwave therapy pairs so nicely with your P shot.
Yes.
And when you're talking about performance and increasing performance in the enhancement of that, and it takes, not 15 minutes or so
Yep.
to do. It's not painful, and it targets erectile dysfunction. It enhances your performance. There's no downtime as well.
Yep. Yeah, and something else interesting about shockwave therapy is it also similar things in the female anatomy can happen to the blood vessels that feed our specific anatomy, known as the vagina. Also, not a bad word. So we can also use this therapy for that. This talk is specifically for males and how it works in the vessels that feed the penis with blood. But shockwave therapy has been around for a long time, being used in multiple ways to heal tissues. I think that it's also important to know, hold on, we're going to time out because I just lost my train of thought.
You're fine.
So there's been a lot of research done on shockwave therapy specifically for erectile dysfunction. There are even advertisements for machines that can be used for in-home use. Something that I wanted to highlight about shockwave therapy specifically is the level to which the energy is being delivered actually matters. And Jennifer and I are familiar with this with our other devices we use in aesthetics. Where energy is dropping is going to be consistent with your results. And it has to be the right type of energy, the right frequency of energy, and it has to be at the right tissue depth to actually make a difference. So you could potentially spend on Amazon, for example, $300 to $1,500 on a home use machine, depending on your budget. You're not necessarily going to see those results because you're not getting the tissue that you need to affect properly treated.
I think of it as like the red light masks,
Yeah.
the red light devices that you can get on Amazon. They're not as effective. They don't have that efficacy to do the medical level of services that we're due. A little fun fact for you. The shockwave therapy is as fast as the speed of sound.
Speed of sound. Wow, that's incredible.
Just like Amazon's delivery. Thanks for listening today.
We super appreciate you being here. If you enjoyed our content that we presented today, please like and follow below. We are going to be coming up with lots of new content for you because this is ever changing and so important to learn about.